Welcome doctors to my lecture. Hope you are doing well. We are studying neuroanatomy. Today we will discuss an important topic related to eye, that is internuclear ethalmoplegia. This is an important topic from clinical point of view. Please revise this lecture again and again for better understanding. Please do subscribe my channel and hit the bell icon. I will be uploading more lectures on important topics soon. This video is dedicated to my cutest sister. Conjugate gaze is the unidirectional movement of both eyes towards same side. When person intends to see left, both eyeballs turns towards left, and when person intends to see right, both eyeballs turns towards right. In conjugate gaze palsy, the unidirectional movement of both eyeballs towards same side is affected. As a result, when person intends to see left, the right eye keeps looking straight ahead. Similarly, when a person intends to see right, the left eye keeps looking straight ahead. Now we will discuss the pathways responsible for the unidirectional movement of eyes and the related lesions that leads to conjugate gaze palsies. Respected doctors, now please concentrate to understand the pathway of internuclear ethalmoplegia. This is the pathway responsible for unidirectional movement of eyes in horizontal conjugate gaze. When a person intends to see left, the nucleus of abducens nerve of left side starts firing, which carries impulses through abducens nerve to left lateral rectus. The contraction of left lateral rectus moves eye to left side. Now for conjugate movement of right eye, right frontal eye field starts firing impulses towards the paramedial pontine reticular formation, that is PPRF of contralateral side. This left PPRF send impulses to abducens nucleus. Abducens nucleus then sends impulses to nucleus of oculomotor nerve on contralateral side through right medial longitudinal fasciculus. The oculomotor nerve supplies medial rectus. The contraction of medial rectus moves eye to the left side, that is same direction as that of left eye. There are two types of internuclear ethalmoplegia, that is number 1 right internuclear ethalmoplegia and 2 left internuclear ethalmoplegia. Now in right internuclear ethalmoplegia, there is lesion of right medial longitudinal fasciculus. Right eye is unable to adduct and the nystagmus is in the opposite eye due to overfiring of abducens nerve to stimulate oculomotor nerve. On the other hand, in left internuclear ethalmoplegia, there is lesion of left medial longitudinal fasciculus. Left eye is unable to adduct and the nystagmus is in the opposite eye due to overfiring of abducens nerve to the stimulate oculomotor nerve. The important points regarding internuclear ethalmoplegia are: number 1, nystagmus is in the abducting eye and convergence is normal. 2. Medial longitudinal fasciculus is highly myelinated so that both eyes move at the same time. 3. Most common causes of bilateral internuclear ethalmoplegia are multiple sclerosis and stroke. Respected doctors, now it's time to test your knowledge. Question: what characteristic eye movement abnormality is seen with a lesion to the medial longitudinal fasciculus? Options are: A. Internuclear ethalmoplegia, B. Opsiclonus, C. Vertical gaze palsy, D. Gaze evoked nystagmus. I know you have got it. If you recall the lecture, you will get to know that correct option as A, that is internuclear ethalmoplegia.